All right, everybody, welcome back. We're going to get started with public health portion of our day. So I'd like to introduce you to our first presenter. I'm glad to welcome him back. It's been a couple of years since we've had Dr. Weed presenting at our Public Health Day, so we're glad to have him back. Dr. David Weed is the Executive Director of Partners for a Healthier Community and coordinates the Healthy City Fall River, an initiative of the Mayor's Office in partnership with the Massachusetts Department of Public Health's Community Health Network area. Dr. Weed retired after 33 years as a clinical psychologist for the Massachusetts Department of Mental Health, where he worked on a number of health promotion projects for adults with severe and persistent mental illnesses. So we're glad to welcome Dave back, as I said, to provide us a nice landscape understanding of public health here on the South Coast. So over to you, Dave. Welcome, and here's your clicker.
Well, thank you. It's nice to be here again. Everybody can hear me okay?
Yes.
Okay, good. I know a few folks here, but I haven't had a chance to meet the rest of you, and maybe if I get to stay a little bit later, I'll know a little bit more about who you are and what you're doing, and I'm always excited about the Leadership SouthCoast projects that you get involved in, so I'd love to hear more about those. We're going to spend a considerable part of the day after my presentation talking about one specific health problem, opioids. So I'm not going to cover that. I'll make a brief reference to that, but you're going to hear plenty about that, so there's no sense in my repeating statistics and things of that sort. What I want to do today is just give you about a half-hour overview of what's going on in the South Coast, not only in the way of health assessment, but also what some of the things are that we're doing, particularly in the city of Fall River, to address the problems that we've identified. We could talk for the rest of the day about all the health problems there are here. There are lots of them, as there are across the country. We're not all that unique, but without your getting a better understanding of what you do to improve those, the health status in any one area, it's not of particular use. I don't want you to walk out of here just being discouraged and saying, you know, things are terrible and there's nothing we can do. There's a lot we can do, and some of those things we're already doing, but with your help we can do a lot more, okay? So let's take a look here in the South Coast of what the status of health is here in this community. And in particular, what we can do to improve it. How many of you saw this news article? It appeared on March 29th. Tracy did. Anybody else? It's in the Herald News. I'm sure you all read the Herald News the first thing you get up in the morning, right? Okay. Like everybody else. The article was based on a nationwide study that's done interestingly by county across the country. So there's a report for every single county in America, which is a good way to do comparisons county by county across the country. And largely because, unlike Massachusetts, most states organize their public health efforts by county. We're strange in Massachusetts. We have, you want to guess how many public health entities in this state? How many towns? 351, right. And we have a public health entity for every one of them. It's bizarre because we have little towns that have a half-time person who's supposed to handle public health, and mostly what they do is take care of the water quality and monitoring and things of that sort. And then we have large cities like Boston that has a huge public health effort going on there with over 100 employees, I believe. And they do an awful lot of very good things there. So you can see already there's a big discrepancy in terms of effort to address public health issues across the Commonwealth. And that's pretty much the case across the country. Some counties do a good job, others not so much. So looking at Bristol County, what do you notice? Are we in good shape? Guess by the headline. Well, compared with the rest of the Commonwealth, we're in not such good shape. We're 13th out of 14 counties. Only Hampden County out in the west, which is Holyoke and a few other towns there, is doing worse, a little worse, not a whole lot worse, but statistically we're kind of almost at the bottom, okay? And if you look across Bristol County, you'll notice that there are differences town by town. Where do you suppose most of the health problems persist in Bristol County? Anybody want to take a quick guess at that? It's going to be in Marion, Mattapoisett, where do you think? Fall River, New Bedford, and to some degree Taunton as well, the cities, okay? Because, as we'll soon see, that's where more of the health risk factors are located. But with this kind of assessment, we get a picture overall of health in the state compared with the rest of Massachusetts. In fact, how does Massachusetts rank nationally? Anybody heard that? Are we at the bottom?
Toward the top.
Toward the top? Usually in the top 5. Last year we were tied, we're second to Hawaii. Okay, this year we're number 1. Okay, so if you look at Bristol County and you say we're almost the worst state health-wise in the state, but the state is one of the best in the country, what you end up with is Fall River and New Bedford, Taunton are kind of average for America, okay? And if you go to other states, I won't mention them, but they're in much warmer climates, they do much worse health-wise, okay? And the states that are in the bottom 5 are really experiencing the same kind of difficulties statewide that we see in some of the worst areas in our county. Furthermore, let me just say, within the whole city of Fall River, are you likely to see what we call disparities, differences in health status from one place to another? Are we uniform or not? Anybody want to argue for the idea that you can live anywhere in Fall River and your health will be pretty much the same as everyone else? Is that the case? No, you're shaking your head, right? There are sections, zip codes, if you will, census tracts in Fall River where the health status of that area of the city is about the same as the rest of the state as a whole. In other words, pretty good. And then there are parts of the city, zip codes and census tracts, where people's health is about as bad as it is in Mississippi, depending on what you're looking at, okay? So we call those disparities inequities, right? That there's a difference in your health status depending on where you live. Well, let's take a look at some of the detail of this. On the South Coast, we have high rates of tobacco and substance abuse. You're going to hear more about opioids in particular, blood pressure, cholesterol, heart disease, heart attack. Read the list, okay, all the way down. We are good on breast cancer, slightly better in Fall River than it is on average on the state, interestingly. But just everything else there on the list, we're near the top, okay? Not a good place to be, right? Unless you're applying for a grant. We all know that if you're going to apply for a grant to improve health, you want to look as bad as you can. So we've been pretty successful on that. Yep.
Does the breast cancer rate, the low rate, have any association with the fact that we've got SouthCoast Health, we've got some big anchor hospitals here that maybe are very proactive?
Well, that doesn't determine the rate at which people acquire the disease.
Okay.
It does have a lot to do with how easily people can access treatment here. And I will say that the screening rates for breast cancer are higher here than they are in the rest of the state. So the hospitals, like St. Anne's, does a super job of getting people mammograms and other screening for cholesterol, blood pressure, etc. We do very well on that. So in a sense, we've got a sick population that's well doctored. Okay, one way to put it. Okay, looking at a couple particulars here. This is one of our top 10 bad health outcomes. You notice Oliver, is that hard to see there? 17% on mothers who smoke during pregnancy. These are somewhat old statistics, but quite frankly, this is as recent as I can find on the state listings. But 17% were significantly more higher than the state at 6.3. Okay, so almost 3 times that rate. Is it good for young moms in particular to be smoking while they're pregnant? No. What does it lead to? Premature birth, some problems with neonatal problems, low birth weight, etc. So it also means that their children are born with nicotine addiction. You're going to hear more about opioid addiction in children born with that. So starting life out as an addict is not a good place to be, particularly if you're premature, underweight, etc. So it's one of those measures of health statistics that we really need to make some improvement. That has come down, that 17%. It was in the low 20s 5 years earlier than this. So it's moving in the right direction, but we've got a lot more work to do. Have you all met Lisa Alves here yet? No. Lisa, raise your hand, Lisa. Lisa works at the WIC program, that's the Women, Infants, and Children program, and she works with young moms all the time, and smoking is a big concern and something that we address. And we want to look at all the ways that we can encounter people who are having these health risk behaviors early on. Let's look at teen birth rates. Again, we've been in the top 10 in the state consistently since I've been here over the last 30 years or more. The most recent statistics, though, from 2012, we've come down actually on that. And we're now, we've improved, I think we're like 12 or 13 statewide, so things have gotten a little bit better. The entire teen birth rate of the Commonwealth has gone down in the last 10 years, and it's moving in the right direction. But you can see we've got a long ways to go, as does New Bedford and Brockton, to get anywhere near our state average. Remember, the state average is one of the best in the country, so if you put that together, there are places around the country that 36 births per thousand is low in comparison. And finally, just looking at a detail here of overweight and obesity. You might think, does anybody want to guess what town in Massachusetts has the lowest rate of overweight and obesity? I'll give you a clue. It's northwest of Harvard Square. Not Somerville, no, though they're doing some things like we're doing. Arlington, okay. In a very low rate, we're getting down in 10, 11, 8, 9, 10, 11, I think was the last one I looked at. So they're one of the lowest in the country, okay, particularly in terms of urban areas on weight. But with an average for the Commonwealth, over here at 20, look at the Cape. Why do you suppose people weigh less on the Cape? Only because they have to get into bathing suits more often, right? I don't know. But if you look at Fall River and New Bedford, you notice that we're not moving in the right direction. That since 2006, the latest statistics, 2014, we've gone up from 26 to 32, as has New Bedford, 25 to 33. That follows a trend that's the same across the country, that overweight is a growing problem, and it goes right along with one particular disease, diabetes. Okay, those rates are in parallel with the rising rates of overweight and obesity. And then related to diabetes is heart disease. And I'll maybe get into a little of that, but let me just say that half of the people who have heart attacks also have diabetes. Okay, so there's a strong correlation among those things. So when we look at these figures, we see that Fall River, New Bedford, out of some of the southeastern areas, is not doing as well. So we have our challenges here on the South Coast. We also have low levels of education, right? High unemployment. I love the way Fall River's unemployment rate is always half of whatever the state, or double whatever the state average is. You ever notice that? Okay. Right now the state average is like 3 or 4%. Well, we're at 7 or 8%. You know.
Like 8.5.
Pardon me?
It's up to 8.5.
8.5. It's gone up in the last couple months, right? But we kind of track that way. So no matter what, and even with Amazon open, you know, we're still seeing much higher unemployment rates in this area. High numbers of homeless. You've probably seen reports of one sort or another. Those rates tend to be much higher in the urban areas than they are in the towns. Adults and children in poverty, always a consistent rate. We're in the low 20% or so. And that hasn't changed much in the time that I've been here. And then the stress related to that economic status, try living on, you know, $18,000, $20,000 a year and see what your stress level is, okay? And then immigration and language, I think, which are also stressors that impact health. Is there a relationship between these factors and some of the health status indicators you saw? You're nodding your head. Why?
Well, if you have a higher income, you have more, well, people in higher income areas have more access to like farmers markets, fresh produce. People who live in poverty are often living in what are known as food deserts where they don't have access to that type of food. You see that soda is cheaper than water, so that's already up there. And the stress of living in poverty, like you said, when people are impoverished, it just creates a whole new set of fight or flight, and it impacts you psychologically. And also living in a safer area allows you to go for walks. So people on the Cape, one can probably afford a trainer or afford a gym membership, but if they can't, they have access to beaches and parks and safe neighborhoods. Where if you're living in somewhere that's crime-ridden or unsafe, it's not walkable, the sidewalks are beat up, you don't feel safe going out walking with your family. All of those are factors that impact your health down the line or not down the line.
You nailed it. Do you have a degree in public health? Well, absolutely. Every one of those factors. Access. Just if you want to track health status in any area, look at two factors: education and income. Okay, those always parallel. Okay, so as income or education rises, health improves, and all the other factors you talked about. What we often say in public health is place matters when it comes to health. Where you live, what your zip code is, will predict what your health outcomes are going to be. Okay, and we talk about that. There we go. In this way, this is from the Institute of Medicine, it's unreasonable to expect that people will change their behavior easily when so many forces in social, cultural, and physical environment conspire against such change, right? Okay. It's easier to be healthy in the right environment, right? We call that environment social determinants of health, conditions in which people are born, grow, work, live, and age, and the forces that shape the conditions of their life. Those include economic policies and systems, development agendas, social norms, social policies, and political systems, right? You're all involved in this, right? Aren't you? Leadership South Coast works on the social determinants of health, correct? Your job does something related to this. Am I wrong? Okay. I'm talking to the right group, right? Okay. So you're involved in health because you're involved in the conditions that affect health in this community. Right? So looking a little more in depth on that, everything from economic stability, the physical environment, education, food, community and social context, and the healthcare system. Usually we talk about health status, people immediately think of doctors and hospitals. Well, public health doesn't, that's like it's 8% of what determines someone's health. The rest of it has to do with all these other factors here. Is it easy to control all of those? No, we wish, right? If we could change all those things and make improvements in every one of those factors, we'd have a healthier population.
Currently, social service agencies are nonprofits. So, as Dave said, for a 2-year term, I'm serving as chair of CHNOP, even though I'm employed and work for St. Anne's Hospital as a volunteer. And my predecessor here, Lisa Alves, who was introduced to you earlier, at WIC, she was the prior chair. So we do it in a voluntary role. But one of my goals as the chair would be to have more private sector. Some of you sitting in this room represent businesses. Because what we just learned in this room today is that really health is, and improving our health in our community is very little to do what happens in the walls of St. Anne's Hospital, or the walls of Cheltenham. We want folks to go to those entities when they're truly seriously ill. We want to keep the community healthy, and that it really involves, and it's in everyone's best interest. So we need educators at the table. We need businesses at the table to work together collaboratively to raise the level of health for all of our community members, not by zip code, but by improving our environment collectively and educating our environment and educating our community collectively. We've got to get into those schools, and you'll hear some more about that. But we're working hard at the early on in the 4th and 5th grade levels now to change this cycle and to educate and to bring up the next, the generation and improve education levels. Because you saw that health correlates with economics. So bring everybody's level up. Hopefully, it will improve the health of the community. So we need to work together and collaboratively. And we heard earlier about the ACO model, the accountable care. We are moving towards that in healthcare, where hospitals, health systems will be paid based upon outcomes. So everyone's going to be incented to keep everyone healthier from the get-go.
So Tracy, any of these organizations want to get involved with some of your subcommittees on the CHNOP, how would they begin to get involved?
Well, you could reach out, to me directly. You could reach out to partners. Dave runs the website. I guess one of the ways too would be to talk to whoever your leadership is in your organization. Indicate you'd like to get the organization more involved with the community health part, and then reach out. You could reach out to myself, to Dave, and we can connect you. We'll bring you into one of our meetings, our monthly meetings. We meet the second Friday of the month, 8:30 to 10 at Health First, and we would introduce you, let you see what it's about, and maybe get your organization to sit at the table as part of the steering committee. Or you could, like you said, you'll hear that, or Dave mentioned that, we have 5 working groups. So you don't necessarily have to come to that steering committee, but you could be on our suicide prevention work group. You could be on our substance use disorder work group. You could be on our health and well-being work group, where we work largely with homeless families and families in urgent need. We also have our school and community partnership, where we're working with youth. If that's one of your real interests, or where your organization might plug in better. And we also have our healthy eating, active living, which Dave chairs. And you can see the passion that Dave brings to it. So something around policy. We like to work on policy. Dave interacts with folks up at Harvard and Tufts all the time. So he's in the throes of at the top level. So you can really make some impact if you were to join on to and Dave didn't mention, but he's retiring and leaving us in June. So he needs some good, young,
That's right.
bright
We want
minds.
all of you to show up.
Yeah. So that's how they can get involved. So you can be on the working group, and you can be on both.
And if you don't have an idea of what you want to do or can do, just come and we'll help you figure it out. Okay?
Right.
But there's something that every single person in this room can do. Okay?
And bring it back to your leadership, in your organization, and say, hey, we should get more involved with public health because it impacts our business.